Hello, my name is Jennifer Yardley, and I am doing the skills video administration of oral medications for BSN 225. So the first thing I'm going to do is I'm going to verify the provider's order and make sure that I gather my supplies. I'm going to need the gloves to put on, a towel to wipe the bottle after pouring the liquid medication, our medications, hand sanitizer, and a cup for them to drink their liquid of choice, and the liquid medication. So I have all my supplies. I also have a little med tray to hold everything at eye level. So I have all of my supplies. Now I'm going to review the 6 rights of medication administration. So I have to verify that it's the right patient on the EHR, the right drug, the right dose, the right route, the right time, and then the right documentation. Then I verify that everything looks good, that it's the right, all of those things, right patient, right medication. If for any reason the dosage was wrong, then it would be something that would have to be brought up to the doctor or contact pharmacy to see if there is different concentrations. So that's why it's always good to check, because sometimes there are med errors even when they fill the MAR with medications. It might not be the right dosage and you could over or underdose the patient. So I've checked the MAR and I'm using a number 3 scenario. So we have the 4 medications. We have amoxicillin, and that's 250 milligrams, and that's an antibiotic. And some of the I'll tell the patient later. But we have the amoxicillin, we have the metformin, and that's 500 milligrams. And then we have the Benadryl, 25 milligrams. And then we have the acetaminophen, that's 500 milligrams in 15 mLs. So now I have all the medications. I verified the order, I verified it against the EHR, and everything's correct, so I'm ready to go into the patient's room. So first thing I do is I'm going to knock on the door, knock knock, and then I'm going to open the door and close the door for privacy and introduce myself. Hi, my name is Jennifer, and I'll be administering your medication today, and this will take about 5 minutes. I'll also take time to go over the reasons for the medication and then some adverse effects and things to look out for, and let me know if any of these abnormal side effects occur, to let me know right away. So can you please state your full name and date of birth? Okay, and then I compare that against the wristbands, and it's correct. So now I have the right patient. Then I can talk about the medication. Oh, also, before I begin, do you have any allergies, including foods, environmental, or drug allergies? No? Okay. So, also, what was I going to say? Also, do you have any questions? And I know, okay, now I'm going to have you sit up, or sit up at, so that when I give the medication that it's easy to swallow and there's less chance of choking. So you're in perfect position. Now, I'm going to, as I get the medication ready, I will explain what the medications are. So I am going to wash my hands and put on my gloves. So the first medication is amoxicillin. Amoxicillin is an antibiotic. Some of the common side effects would be nausea or diarrhea, but some of the adverse ones that we want you to report right away are wheezing and hives. And so I have the amoxicillin, and I'm going to open that and put it in my cup. It's harder with the gloves. It's not something we can practice ahead of time. Okay. And that goes right into the cup. And then the next one is metformin, and this is a medication that helps control blood sugar. Some adverse effects would be diarrhea or loss of appetite, and some abnormal ones that you would want to report would be abdominal pain or shallow breathing. So you would report that right away. And then the next one we have is Benadryl, and this is for allergies. Benadryl will often cause drowsiness, or so you would want to be careful getting up, like get up slowly, and then dizziness. If you did get up quickly, that would be also a common adverse effect. But the ones that we want to look out for are urinary retention and seizures. And then the last one is, well, first I will give the pill form and fill this with the liquid of choice, give the pills, and then the drinking the water. So here you go. Good. And I think I already said, did you have any questions prior? No. Okay. Well, then I would give the medication. Now, then the last one is our acetaminophen, the liquid suspension. And with this one, you want a flat surface. So, I'm going to have my tray. This is a little hard. How am I going to hold this up? Use my... Sorry, give me a minute. Tray. I'm using my computer as a stand. And so I have my tray, and then I get my my little cup, and then I go down to eye level. So eye level with the tray, and I would remove the lid and put the cap down upside down so that the inside of the cap doesn't get messy and then contaminate the medication. And then also we want to cover the label as we pour so that if there's any dripping, it doesn't damage the label and then it become unable to be read, and then you don't know if you have the right dosage and like the expiration date you can't read, and then you just have to toss it, and that'd be wasteful. And also it's just, again, safety for the patient. So I'm going to pour the 15. I'm getting down to eye level. Okay, so it's at 15, and I will show you. You can't see it, can you? It's under the 20. I don't know if you can see, but when it's down, it's at 15. So I'm ready to give that. And prior, I forgot to say, when pouring, you want to swish the bottle to make sure that there's nothing wrong with that medication either, that there's no suspension, like you have to make sure that it's fully mixed and that there's nothing like wrong with it. So then that was good to go. And so now I can give that medication. And sorry, this is really hard. And pour, and then they get to drink their liquid of choice. Okay, now they've done taken all of their medications. And do you have any other questions for me? How's everything feeling? I also forgot to say, prior to giving them acetaminophen, you would ask them the parameters for that medication. So for acetaminophen, it would be pain scale from a 0 to 10, and compare that to the MAR with the level that is required to give. And so they met those, and so it was okay to give. Now, so yeah, when I poured the medication first, I swirled, made sure that it was good. I covered the label when I poured to make sure the label didn't get messed up. I had the cap turned over so that stuff didn't touch the inside of the cap and get inside of it. When I recapped, I wiped the lid with a towel to make sure that it was clean and dry, and then closed it, or made sure that it was properly closed. And so now I'm done, and I can then remove my gloves, wash my hands, ask if the patient needs anything, and put the bed at the lowest level with the side rails up, call light within reach, and then I would wash my hands, go and document to make sure everything that I did, that it was the right, all of the medications I give, that was the right dose, the right time, the right route, and that they that there was no side effects or any adverse reactions, anything that would cause that to happen, or if they refused any medications, the reason for their refusal, anything that would be helpful for the doctor to see the possible changes in medications, etc., etc. So, yeah, that's it. Thank you.